Hey everyone, it's Dr. Polen again here from Superior Chiropractic and Rehab. I have two phenomenal guests with me today. One is a really good friend from college, and then another one who I've been following on Instagram for quite some time. They're both brilliant, smart, and I just love everything that they have to post on social media. So I have Dr. Jake Anderson and I have Dr. Chris Erickson. Welcome.
Hey, what's going on? Thanks, Brad.
Thank you very much for having us.
So if you guys don't mind, can you guys just give me a little bit of background on what you both do and how you help your community in Nebraska?
Yeah, for sure. I'll start here. Yeah, I'm Jake Anderson. I'm a chiropractor. We're both in Elkhorn, Nebraska out here. So we have a multidisciplinary clinic. I'm a chiropractor. Chris here's a physical therapist. I'm in my second year of practice. So we have a multidisciplinary practice out here. We primarily see neck, shoulder, low back, hip, but we're in a sports complex. So we see, we get a handful of sports injuries, knees, ankles, shoulders on the volleyball side. And yeah, we love helping people out, getting them to reduce their pain and then get back to like a lifestyle of fitness and exercise.
Yeah, so like I said, my name is Chris Erickson, physical therapist. Been doing this quite a while. It's probably 15 years or so.
Yeah.
I've owned some different multidisciplinary clinics in the past. And so I knew when I partnered with Jake and Jeff out here and these guys for the last 3 years, this is what we needed to do. And it's the way that we believe in helping people. It takes the right group of clinicians to do that. You have to really put the ego aside. We don't care whether someone needs more of one thing or the other. There's still a lot of animosity and closed-mindedness or fight among the professions, and we really don't care, because we just whatever someone needs to fix the problem. I mean, I specialize in spine as well as an MDT certified clinician. Obviously, Jake specializes in spine as a chiropractor, so we do see a lot of that kind of mechanical spine pain. On the PT side, we will also see an occasional post-op type situation, like a total knee or a shoulder, post shoulder surgery, rotator cuff, that kind of thing. Yeah, that's kind of what we do, and we really believe a lot in taking people past that point of, like, yes, their plan of care, say, is completed, but we don't really use the word discharge around here. We try to, transition them into more of a lifestyle of fitness. And I do a lot more stuff now online with helping people return from a disc injury and getting back to high level fitness and strengthening with exercises that they're told that they should never do again, like squats and deadlifts and that kind of thing. So
yeah,
so that's a brief. Yeah, that's what we do.
Deadlifts are bad for your back.
Oh, I can't do it. Yeah.
I know it's funny you mentioned that, because Jake and I always joke about that, how all the people who come into not just your clinic but my clinic as well, they told me that the doctor said they should never squat again, they should never deadlift, and I'm just like, that's just complete baloney. Yeah, so you two know that just as much as I do, which I love it. And I know in my very first year of practice, and I know Chris and Jake, you can expand upon this a lot more than I can, but I've come across a lot of stigmas, not just with chiropractors, but also with physical therapists.
Yes.
And I kind of wanted to ask you guys this question right off the get-go, because there's a lot of that stigma that you were just mentioning, Chris, between chiropractors, physical therapies, doctors, and whatnot. From your guys' realm of expertise, what would you say the most common myth that you've come across since you guys have both been in practice?
Yeah, so on the chiropractic side, it's that we only treat spine and we only crack backs, and that's just that's all we do. So I guess a lot of people don't realize the level of education we have. And from the outside, yeah, it might look like we're just pushing on your back and making some noise and everything, but there's a diagnostic process. We do a full history, we do a full exam. Everything is guided by what we find out, not only from what the patient tells us, but then from moving them around. That's where we get the most information. And outside of the spine, we still treat shoulder, elbow, wrist, hip, knee, ankle. We're well-rounded to handle pretty much any spine, muscle, or joint condition, even as chiropractors. We also get the bad stigma that it's just 5 minutes, pop. Yeah. See you next week. You guys do this for the rest of your life.
Yeah, 3 times a week for the rest of your life.
And unfortunately, that is a common model in chiropractic. I would argue that that's mostly driven by money. So those providers are just trying to just get you in and out as much as possible to make as much money as possible. In the clinic setting we have here, our follow-up times are 20 to 30 minutes. We're doing a lot more than just adjusting. We're doing soft tissue therapies, dry needling, cupping, different mobilizations, McKenzie, and then low-level rehab stuff, and then deferred PT for the higher-level rehab stuff. But then, you guys get a lot of that stigma there too.
I mean, the same thing happens on the physical therapy world. I mean, just like in any profession, there are some chiropractors who do a very good job, like we believe we have here. There's some that are, not very good. And it's what gets the like you said, stigma of, oh, don't go to that place. All they're going to do is, crack you in out the door. They don't really help anything, or they make you worse. Same thing happens on the PT side. There's some that are very good and some that are, very poor and still practice that very much something that we speak out about quite vocally and quite often, that cookbook style model of everybody gets a hot pack in Easton when they come in the door. Everybody gets ultrasound. Everybody gets hamstring stretches. Go sit on the bike for 10 minutes. Go sit on the treadmill for 10 minutes. And then, that's the myth, is that's what, PT looks like, is they don't talk to you. They sit you on a bike. You see a different person every time you go into one of those larger, PT clinics. You got to tell your story from a patient perspective. You got to tell your story every time you go in, because you're seeing somebody different. It's painful. They have you do all these things that don't work. It's the same exercises every time. Okay, work a couple core things, a couple hamstring stretches in a hot pack, and you're out the door. And unfortunately, just like it does in other, in chiropractic profession, that does still happen in places. So we take every opportunity we can to explain that it's not always that way, and there are different ways to approach things, and that's the one thing that we have obviously learned over time, and try to educate people as much as possible. The difference, or when you talk about mechanical pain, especially mechanical spine pain, you could see 10 different people and you would get 10 different treatments, protocols, because
they're wildly different.
No standard of care for that. So you have to continue to ask around, look around, and find what works for you, because it's just not a one thing that works for everybody.
Yeah. And, from before I opened up this clinic here in Glen Carbon, I was in a clinic in which we dealt with a lot of insurance cases. And it seemed like a lot of our treatment dictated based on what insurance was going to reimburse us, which, would you guys say that's kind of similar to what you guys have experienced in the past as well?
So I guess the way I'm going to word this is, insurance can absolutely dictate how you provide care. On a Medicare patient or a Medicaid patient, you're not getting reimbursed well as a provider versus someone that has, a traditional Blue Cross Blue Shield and a plan like that. Honestly, in my opinion, I'm just going to try and provide the same high level of care to everybody, regardless of what I'm getting reimbursed. That's just what the patient deserves. Yeah. And if you only do what the insurance tells you can do, you're probably not going to get the best results that are available to you. So that's my perspective on it. I try not to let it dictate anything that I do, but I can definitely see how some providers will shift towards that way and just do it, makes them the most money.
Yeah, I mean, we are an in-network clinic.
We are, we take insurance.
We take insurance, and we also are a for-profit company. Yeah, I mean, we have to make a profit in order to keep our doors open. But a lot of times, because we combine with things, Medicare patients, for example.
Yeah, that's a perfect example.
Jake cannot get reimbursed on any kind of therapeutic exercise, therapeutic activities, those kind of things. The stuff that he would want, even manual therapy, like it's only the adjustment code.
Yeah.
So in our case, because we have different disciplines, that person can still get all the care they need, and I will just see them, or one of the PTs will see them. And now, can we bill for those things? Yes, we can bill for those things, and so we can still reimburse on those, but we're not going to do anything less for the person, because if we'll just figure out how we're going to see them. Yeah, so that we code it the correct way and appropriately, but that they still get high level care. Yeah. And we do see, a combination of insurance patients and some that, choose to pay self-pay cash. We also have massage therapy here. So there's, that's almost always cash pay. So.
And that's really great to hear, because I know a lot of people, when they go, like, they came to my clinic and they were afraid of what I would do based on their deductible, their copay. Could I give them the amount of treatment that they actually needed? And it seems like, we're both on the same mindset with that, because we both have the same mission of essentially keeping our community strong, active, and healthy without any sort of prescription drugs or surgery. Like, that's the last thing we want people to be on, is an opioid or getting low back surgery that has a failure rate of over 50%. So it seems like what you guys are doing out in Nebraska is great. And I'm just and I just applaud all of you guys out there for doing what you do. Now, this next question, I think we kind of tied into it a little bit with what I just asked about the insurance portion of it. If you go to, and this is what I think is great about chiropractic and physical therapy, is that if I go to 5 different physical therapists, I might get 5 different treatments, but it all does the same thing. Same thing with a chiropractor, 5 different adjusting techniques, but it all does the same thing. Yeah. So what would you say is one thing from your areas of expertise that almost no one agrees with at all?
That no one agrees with. All right. I would say Well, the combination of care, that's
Yeah.
not common, but I guess we're heavy like MDT, McKenzie docs. So for
Yeah,
any
no,
docs
no
watching,
one
they-
agrees with
they
like
find-
how, like you said, how to treat a mechanical,
Yeah.
centralized mechanical spine pain. No one's, or very few people are gonna agree, okay, I'm gonna do it this way, we're gonna move this way, move this way. Someone else is gonna say, well, no, that's wrong.
Yeah.
You have to do strengthening here, you gotta plank or do, there's gonna be very little agreement on how to treat that kind of condition.
Yeah.
Other things, post-op,
That's-
total knee, that's
that's
much
got a
more
plan.
standardized and agreed upon care.
Yeah.
But I would say mechanical neck and spine, neck, low back pain would be not very agreed upon, depending
No.
on where you go.
And it's gotta be individualized anyway, so specific to each patient. But yeah, we try to classify them as much as possible within our system that we both speak.
Mhm.
And that allows us as providers, especially with different disciplines, to be on the same page when we're managing like a
communicate.
co-treated case. So I think that's probably something different.
And probably even just the combination of doing both things. I think
Yeah.
that for the most part, our patients get it and they want it and they ask for it. Yeah, that makes sense. Why don't I have to go to different places? You do different things. It makes me feel better. But the clinicians tend to not agree that they say, no, you have to go to an MD, no, you have to go to a chiropractor, or no, you have to go to a PT, or you don't ever go there.
Yeah.
So that's not very well agreed upon.
And kind of tying back to what you were saying, Chris, regarding the whole McKenzie protocol. And for anyone who doesn't know what McKenzie protocol is, it's a system of how it's mechanical sort of pain that usually is radiating some form of way from the spine. And correct me if I'm wrong, Chris, but is that the overarching aspect of MDT?
Yeah, the MDT is an assessment system. People quite often misinterpret or misunderstand it as a specific exercise. Well, you have to do this McKenzie exercise. There is no such thing as a McKenzie exercise. All movements, exercises, loads, positions can be underneath the system. Think of it like an operating system for a computer. Anything you need to, run that system is the McKenzie or MDT method. So it's more of a assessment and diagnosis system that allows you to understand what someone has. Once you can kind of subcategorize and what someone is, it's much easier to treat and fix and then use the tools and the things that you got from other continuing education, like dry needling or chiropractic or end range movements or strengthening. It doesn't matter what it is. It's all about knowing when to appropriately apply that thing. You can't just throw out 10 things and say, well, here, I hope this works. Like, let's just throw 10 things out there and hopefully 1 or 2 of them work. It's specifically understanding this will work for you because we understand what's going on. And then it's just a progression of forces to get it to where the person is returning to functional and strengthening exercises as quickly as possible.
Yeah. And the whole assessment technique is understanding how different movements, positions, and loads affect the body.
Yeah.
In the majority of cases,
And you don't have to
90%
have
of the time.
particular symptoms at all.
Yeah.
You can use it for any joint, wrist pain, elbow pain, back pain. It could be very central. It could be, and when we say central, we mean like right near the spine. And when we use the word peripheral, just for the audience, that it means it's going away from the spine, like down an arm or down a leg.
Yeah.
Yeah, and that's a really good way. Like, I've only taken 2 courses in McKenzie, and I need to probably refresh on it because it's been so long. But just from the general concept of it, it seems like it's a really good way. And from my past, whenever I was first getting out, I would throw everything in the kitchen sink at an injury just to see if something would stick.
Mhm. Yes.
And
Yeah.
I would
There's
always,
and
I would consistently miss something. So,
Yes.
based on what you're saying,
It's really an algorithm that you can say, okay, if yes, here, if no, here. So that you pare it down and at the end, you're, a high probability if what's going on. And then once you know what's going on, it's all of us can treat it once we know what's going on. It's the one that if you're like, I don't know what the hell's going on, like, why are they having this pain? It's a way to figure it out.
And you start at what's most common, and then
Just start
continue going through the
hacking
funnel,
off
and you're
things.
like, okay, that's not it. That's not it. That's not it. This is possibly it. That fits the best. Let's go with this for now.
Mhm.
And then you can adjust accordingly later on.
It's very fluid. It very
Yeah.
is, because we know the dynamic nature of disc and spine pain can change very rapidly. You can have, and when you ask people, what makes you it was good on Tuesday, all of a sudden now it hurts real bad. Sometimes I can do this, sometimes I can sit, sometimes I can't. It changes very rapidly. So you need to have something that we all agree upon that we can change very quickly.
And I kind of asked this question without actually directly asking it, and it's kind of funny that you both come to agreements with regarding the same diagnosing algorithm. How the McKenzie method, the MDT protocol, has really solidified you guys' clinical pearls in defining what's going on and how to effectively treat it. So
Yeah.
other than, let's say, other than MDT, what would you say is another, underrated tool? I wouldn't say underrated, but let's say another tool that is in your wheelhouse that's always going to be like if MDT doesn't work, what is your next line of defense?
Yeah. So
well, again, it's MDT is not something that either works or doesn't. It also tells you when you can't help someone and you need to refer them out to something else or
use a different.
Yeah. It doesn't always. So by not having an answer at the end doesn't mean that it doesn't work. It just tells you that this person is either not mechanical, they're mechanically unresponsive. They could have a bunch of red lights and flags that need to get, it could be something like upper motor or centrally mediated. It just helps you decide, can you help them? Which most of the time in mechanical pain you can. And then sometimes, no, this person doesn't belong here. Like something is wrong. It's a fracture. It's some kind of inflammatory condition, but it has all of the different, buckets that, so again, it's not like necessarily that it works or doesn't. Even when it doesn't work, it still works because you figured out that I can't help this person. So then you got to get them to the person who can.
So if it's
and sometimes it's surgery, sometimes it's injections. I mean, that does happen. We do need those things at times. It just is not as common as we tend to see.
Right. So I would say, if someone doesn't fall within the typical MDT response that most people are at least aware of, especially with a peripheral pain, that's when like you throw your neurodynamics hat on and they might respond to nerve glides or tensioners or something like that. Or it's more of a dysfunctional tissue and you just need to load the hell out of it. Yeah, remodel it by loading.
It's clear as day to me that I've essentially forgotten everything from Mackenzie A and B. I need to retake those classes and then finish up with C and D. So it's wow. I'm learning a lot. So I really appreciate you both being on here. Thanks so much. Well, let me ask you this next question. I mean, in my very short time in practice, I've had two folks shadow me. One was finishing up college, going into Logan, and the other one was about halfway through Logan, just kind of getting the idea of what it's like being out in the real world. And so I imagine you two have had plenty of students come by just to be flies on the wall, pick your brain, ask questions, so whenever you do have those discussions with the next generation of healthcare providers, what is the number one piece of advice you usually give them?
Yeah, so on the chiropractic side, one of the biggest issues we have is that school prepares you to pass boards. It doesn't prepare you for real life. So if you are not exposing yourself to seminars, clubs, learning different techniques and not just zoning in on one and saying, oh, I'm going to be a DNS, God or whatever, or I'm only going to do dry needling. Like you need to be exposed to everything because you need to have as many tools in your toolbox as possible and then know when to apply them. That's the hardest part. And you'll learn how to apply the tools by shadowing other doctors. Yeah. So like in my case, we were on the topic of MDT. Like I took A and B and I thought I knew what I was doing with it. And then I got in with these guys and Dr. Brinker, who's down in St. Louis. And I see how those guys actually use it as part of like a diagnostic system and then a treatment system to guide what you're doing. If you don't have a system to follow, you're just, like you said earlier, blindly throwing stuff at the wall and seeing what fits. So you need to gain experience by working with other professionals, finding those people that fit well with you, and then exposing yourself to materials outside of the curriculum, whether that's reading research, going to clubs, or taking further education.
Yeah, I'm going to go a different way with this because I've been doing this for quite a while. And you're right. I mean, first of all, school has completely outpriced itself. I always ask, are you sure you want to do this? Are you sure you want to be a PT or chiropractor? Because it's tough. I mean, it's with the cost coming out of school now, it's outrageous. The things that you have to do. Because they will only teach you, like you said, to pass the test. No one cares in general. Our patients do not care what kind of certifications or letters we have behind our name. So taking continuing education courses is important. You do need to keep your skills, stay fresh or learn new things.
Yep.
But it is more important to me to learn how to communicate.
Yes.
Learn how to sell yourself. You have to take,
especially private practice.
Yes. If you work for somebody, then just go work for somebody, punch in 8 to 5, do your thing. If you have any aspirations to be on your own, you have to learn marketing, communication, sales. I would say now is the best time, better than any other time in the history of since we've ever been, the profession. to explore into online things,
Yes.
courses, digital courses, downloads. You have to create a personal brand. You have to be online. Those things they will never teach you in school. I mean, that's just not going to happen. And that's the stuff that you have to learn in order to be successful, to be on your own. I mean, it's, yeah, we think that it's important. Oh, like he's a, manual therapist, or he's got all these courses, all these certifications behind their name. And in general, like a few people will specifically search certain things out if they're educated on stuff.
Yeah.
But most people, like humans in general, we only care what's in it for us. Like, how can that person help me? I don't care where they went to school. I don't care can they help me get my problem solved, or can't they? Yep. And it's the better you can communicate that and let them understand how you're going to help them, how that is all the communication.
Yeah.
And that is so much further along than what the school, either PT or chiropractic school, will ever prepare you for.
Agreed.
I mean, I had to learn that over years and years of time. Yeah, that did not come easy.
It's funny that you mentioned that, Chris, because earlier this week I did another podcast with one of the local gym owners here in my town. And, he has every certification you can think of regarding personal training. He has a master's degree. He has all these years of experience. And he's like, no one cares I have all these certifications. No one cares I have all this education. They just ask me, can you help me? How long is it going to take? How much is it going to cost?
Exactly. Can you help me lose weight? So it's, how likely is this scenario to happen? And then how much time am I going to have to invest in or money? And then, the trust, how much do I believe that you can solve that problem?
Yeah.
And that's it. Those three things. After that, they don't care where you went to school or how, doesn't matter.
Yeah, exactly. Well, I mean, since we're kind of diving into the business aspect of our discussion, which I absolutely love this conversation because I'm a numbers guy, and it seems like you two are kind of the same way. If you could turn back the clock and if you could start another business tomorrow, what would that business look like?
Yeah, restart another clinic or something totally different.
Let's just say a whole new business in a different field.
Okay, yeah, we're both pretty on board with real estate, 100% real estate investing. So whether that's starting a single family and moving to multifamily, like at the end of the day, we want time freedom more than anything. And as doctors, for the most part, outside of online coaching and consulting, we have to be physically present, Brad, especially on the chiropractic side. It's expected that we're physically present, treating patients hands-on, which requires our time and our having to be in the office. And you can't have a free lifestyle when you're required to show up to the office 8 to 6 every day treating patients. Like, you need to have something supplemental. You need to have something on the side. You need to have assets to make yourself, comfortable in the later years in life, so you can choose to do what you want. So,
yeah, real estate for sure. I mean, I started with single family and the multifamily, and then now into commercial. It's important, that you should, own the building if possible that you have your clinic in. Have different LLCs so that you're basically essentially paying yourself from one pocket to the next because you have the different entities set up. And then for me, it would be absolutely e-commerce. I mean, something very specific. I mean, niche down so specific that you're helping one kind of person solve one very specific fear or problem, or issue. And because of the world is just so connected, and especially after 2020 with COVID, it was a blessing in disguise that people are no longer fearful or even confused about how to get on a Zoom call. Like even older folks now can, like, they used to, I can't do that. I'm not good at the. When they were forced to do it, now everyone does it, and it seems very normal to find answers and solutions and help from across the globe essentially. So yeah, it'd be something more scalable because we only have so many times. You can only see so many people on the table a day. I can only see so many people, like even in a clinic when I'm double booked a day, and then you wear yourself out. But if you could have something that's ultimately more scalable, the stuff you have in your brain, digital assets, make courses, have mini courses, anything like that. And then for us, real estate. Yeah.
I love it. I know Jake and I have talked about a lot of things that Grant Cardone does. And it seems like we're both trying to mimic that because I'm also trying to dive into the real estate game as well. And from what you're saying, it seems like it's definitely going to be a good investment. So I appreciate you giving me that vote of confidence.
It's the first. The first one is hard. Like the first one is hard, and then it starts to, like, it takes it. It's a long game. It's not a we are not in a get rich quick kind of career. I mean, we're trying to build something that lasts and has some pays us over time with perpetuity, but that doesn't happen overnight. It takes some time.
Of course.
Yeah.
It's just like even with your businesses, it's not going to happen overnight. You got to feed
No.
it, nurture it, and over time.
And be patient.
Yep.
Exactly. Well, I know you two are busy bees and it's Friday afternoon, so you guys probably want to get out of the office and start your weekend. So I'll just ask you 3 quick questions and then I'll let you two sneak out for the day.
Yeah.
I've always heard a stat that the most successful people in the world, they read 60 books a year, which on average, I think that's about a book a month, not a month, book a week.
Yeah. It's like,
So what would be 3 books that you'd recommend our audience to read and why?
Yeah, so I've done probably more reading the past 2 years since starting out on my own than I have in the past 26 years of my life.
Yeah.
So Rich Dad, Poor Dad's gonna be a classic one for me. That's just gonna be mostly about mindset and then understanding like how to get out of the traditional rat race that most people find themselves in of working a 9 to 5 the rest of your life. So that was more of a mindset shift. Another book I liked was How to Win Friends and Influence People. So as doctors, we're in the world of, we're conversing with patients all day long. We're directly talking to them, directly communicating with them. So I like that just for kind of like understanding people's psychology and understanding how to better, I don't want to say persuade people, but better, guide people towards making the decision you want them to make, I suppose. And then another third one, I don't know. There's a lot of
there's so many. I like anything by, like I said, Robert Kiyosaki, Rich Dad, Poor Dad. I like everything marketing and business related. So Donald Miller has one called Building a Story Brand. Very good book again about how we're going to make this business and treat customers so well that they have they just
have no choice but
anything by Alex Ramosi, $100 million offers, making an offer so good that a person would be stupid to refuse. Like they'd feel dumb saying no. The offer's so good. Who Not How.
That's a good one.
Yeah, anything by Dan Kennedy, marketing, business stuff.
Like 6 or 7 for you there.
Yeah. So I'm looking at my Audible right now. Yeah, we'll listen to things all the time as we go through them. So, things that have to do with scaling,
business growth, mindset, anything like that,
and systemizing business and really making the customer journey and our client journey and experience as top notch as possible.
That's awesome. So I asked this to everybody because I'm trying to build my library. So I have about, oh my gosh, like 8 books I can get now. So I love it. Thanks so much. Well, I imagine you two, you're not just, reading books, but also listen to a ton of podcasts from a lot of people that you look up to and you inspire to be. What would be 3 other podcasts that you would also recommend to our audience?
Yeah. So I picked out 3 specifically for you, totally different things. So for chiropractic and physical therapy, either doctors or students, Restoring Human Movement is an excellent podcast by Sebastian Gonzalez. His, I guess, like clinical direction or practice style is very similar to ours and how we reason through cases and just the way he portrays that and makes it simple. I think that's a great podcast. Art of Sales. These are short podcasts. I think they're like 5 to 10 minutes long. Mostly about selling, communicating, and then understanding how the person that you're dealing with on the other end is receiving what you're saying and how they're responding to what you're trying to get them to do or how you're trying to sell them. And then my favorite one of all time right now is Bigger Pocket.
Yeah, Bigger Pockets too.
Which is real estate. But not only is it real estate, you can get a ton of business, financial, and systematizing advice from that podcast. Even if you're not interested in real estate investing at all, the value that podcast brings is second to none.
Yeah, I like that one. I like Entrepreneurs on Fire.
Okay.
And then I like the passive income. I can't remember the name of it, but there's something with passive income. And then anything having to do with, again, Dan Kennedy's magnetic marketing stuff with stuff. So.
Love it. Again, like I said, I'm trying to build my library as I know a bunch of listeners are. So I have at least 4 or 5 other podcasts I need to start listening to. And I have a huge star over Bigger Pocket. So I like that. That's good.
Definitely listen to that one.
Well, I really appreciate you two taking time out of your busy day. I just want to say thanks so much for coming back on. What's the best way in case anybody who's listening to the podcast has any questions, concerns, just want to reach out to you? What's your best way to contact you too?
Yeah, Instagram for me. That's where I'm most active. Dr. Jake Anderson. I post a lot on there, and then I'll respond to DMs if anyone messages me.
Yeah, I mean, I try to be on as many different things as possible. Instagram, Exec Health Solutions, or Herniated Disc Fix. I have 2 different accounts there. Me and Jake do some dances on TikTok. If anybody wants to watch us on there, dance around.
Yeah,
We try to make as much content as possible. Yeah, I do have a private Facebook group as well. That's exercise and fitness routines for people recovering from herniated disc pain and injury. So that one's out there, and we'd love to have as many members as possible and keep helping the people that we love to help.
Yeah.
Perfect. I love it. All righty. Well, everyone, I just want to thank you so much for listening to our podcast. It was great having Dr. Anderson and Dr. Erickson on. It's so nice to have you guys talk to us and take time out of your busy day. So thanks again for watching our podcast. We'll see you guys later. Have a great day.
All right, man.